Welcome to The Wellness Effect. I'm Seth. This week we explore universal healthcare and the NHI Act. Dr. Sean Patrick, Senior Lecturer at the University of Pretoria School of Health Systems and Public Health, is going to help us understand universal healthcare within the context of South Africa. Hi, Dr. Patrick.
And thank you very much, Seth.
Thank you for being here today.
Thank you for inviting me.
So we've been hearing these terms of universal healthcare, the National Health Insurance, the National Health Act, the National Health Bill. It's a lot of terms, but why is it important to implement a system of universal healthcare?
Well, I think firstly, you need to go to the World Health Organization. So there is a definition for universal health coverage.
Yes.
What it really means is that you have all the services that are available to everyone, regardless of the social gradient.
Yes.
Social gradient, we mean by regardless of what your economic status is, that you have that all these services should be there. So ideally what we mean is that whether or not you go to a local clinic or a local hospital, all the services need to be there. I think that's in terms of healthcare. Now, obviously not everyone will be able to go for the services.
Yes.
And that is really where the discussions that we are having at the moment is really how do we ensure that people have access to the services? It's kind of a two-pronged question. Have the services available first with the staff, and then access to the services.
So why is it essential in the context of South Africa for universal healthcare coverage to be implemented?
I think from my own, the research that we do. So, for example, we're seeing in certain types of cancers, for example, so in men in particular, so in prostate cancer, some of my work is also involved in that. What we're seeing is that men often present late. So they often present very late. Their cancer at advanced stage. So that stage is it's very difficult to offer treatment and the prognosis is poor. So ideally what we're advocating for is for screening. So every man over the age of 40 should actually go and be screened so that they can be detection, the disease progression is less.
Correct.
But often we find when we're having these discussions is that at the local facilities, there's either long waiting times or there's other issues that are there. So in a way, if you do have universal health care, where someone that does see there's an issue, for example, can go to the local facility, access the services there, then you would detect some of these diseases at a much earlier stage, and you wouldn't burden the healthcare system that much because now it's screening at an early age and you treat.
It's preventative treatment.
Yes. So, and that way you decrease the burden.
Okay.
So then the healthcare system can be there for people that need long-term care, for example. So I think that for me is quite important while we're trying to roll this out.
What is the current state of healthcare systems in South Africa?
Right. So remember the health systems in South Africa, we have the public sector and we have the private sector, for example.
Correct.
And I think from all our experiences, we would understand that not all public hospitals are the same and not all private hospitals are the same. So I would say that the healthcare system at the moment, it's functioning. Yes, there are certain pockets where things are working quite well. And I think there are always areas to improve. If you look at international countries, for example, that have implemented universal health care, the success is varying. Yeah. But in the South African context, for example, I think we still have in certain the areas we have where different type of service is needed. So it's not really a fair distribution of all of the resources we have.
Correct.
And that's the conversation we're trying to have. How do you ensure that all the resources and all the services are available across the entire country?
That's good. Equitable access is the thing that we're trying to define here.
Right. There are in private, for example, you do have certain access to services that are not available in public for various reasons. So I think, yes, there is still this disparity between these two. But again, there are some public hospitals right now that have world-class equipment that is not available at private hospitals, for example. The universities are quite a good example. Universities often have training hospitals that are attached to universities, and they are generally considered to have state-of-the-art, whether it's your personnel, whether it's all of these types of equipment. So I think there is it's sort of, I don't want to say there's an imbalance, but I think there are certain services that each one of the two sectors does have. But I do think during the pandemic, we really saw that we are able to leverage on all of the inroads we've made in the past. So I think for me, the discussion in order to make sure the health system can withstand any other shock is really to understand what we did during the pandemic to make it work, because the system still stood, it didn't collapse, it's still standing. So I think there are ways, and education is one way. Awareness is one way. Early detection and screening is one way. And actually maybe change the behavior in seeking healthcare, because not everyone seeks healthcare early. They rather wait until it's too late. There's not much that you can do. And aside from that, there are many other things that can be done. But I think the healthcare system has proven to be it's as resilient as it can be. And yeah, I do think we are making great progress. And as far as universal healthcare is concerned,
Yes.
as I spoke earlier about the World Health Organization definition. So we have the Sustainable Development Goals,
Yeah.
which are these 17 global goals that most countries subscribe to.
Yes.
And in those goals, there are different targets that we set. Some to achieve by 2030. And what's interesting is one of the SDGs under 3, which is under well-being.
Yes.
It actually deals with a lot of the issues around access to services. Universal health coverage is one of those. And so it means there's this global initiative in order to strive towards that.
Sure.
And I think for us, really, to have it be measurable. So year after year, you can say, we've gone this far, we've made this type of changes.
Yeah.
I think you'll only be able to tell in a couple of years when you look back and you say, yes, this percentage had access to this type of service. Within the next year, that percentage has increased. So is that burden being decreased? Yes or no? But again, something like this would need to be long-term.
Yeah. And I like that you said long-term, because those organizations that you mentioned as part of the World Health Organization, they've realized that this is a long-term ambition.
True.
And I like the element of, setting year-on-year targets for us to get to a place where every South African has access to healthcare. But let's talk about, the systems. How do we make it almost a national agenda? The healthcare systems in South Africa, how do we make that a national agenda to ensure that, while we aim towards this ideal environment, we're solving our own issues?
I think we are. I just think the conversation is happening on different levels.
Yes.
Remember, we have a national level, there's a provincial level, there's a district level, for example. So there are many conversations that are currently occurring there. And I think in order to ensure the health system functions properly, remember there's the different elements. So there's as far as the infrastructure is concerned, so having the physical space to do all of these types of things. So that's one conversation to be had. But again, that is a conversation with the healthcare or Department of Health, as well as other departments as well. If it's in terms of staffing, there's some issues around there. So then again, education and training comes in about. If it's access to services, is it medications? Is it having sufficient medications in the country to treat that? So that's, again, another department. So I think we are working towards that. It's just we need to all work together.
Correct.
And
Collaboration.
that process can often take quite some time, because there has to be this understanding between all of this. But I think we are making
Good
great
progress.
strides.
Yeah.
Absolutely great
You
strides.
mentioned something around, in relation to universal healthcare, that we have some hospitals that are world-class, public hospitals. How do we change the perception around how people feel around some of the public hospitals not being maintained well, but there's some that are world-class. So how do we manage that perception?
I think that's a difficult one. To give you just one example, from University of Pretoria side, because we train a lot of doctors and they specialize, right?
Yes.
So you have in your hospital, you have the specialists that are there. So we are often a referral hospital for some of the hospitals that are quite far. where the expertise might not necessarily be there. Not for lack of trying, but sometimes the numbers that are being trained
Makes sense.
are not enough to accommodate all the hospital. So again, that's another thing about teaching and training. Where does your demand really lie? If the demand lies for one speciality and we're not producing enough of these specialists, you're not going to have that service in each and every hospital, for example. So we are a referral hospital for quite a majority of the hospitals around us. And I think that is one way of dealing with some of these issues. The service is still there. It's maybe not available immediately, but the service is there. So that again, you kind of going towards that universal health care, but we're now doing what we currently have. So you might refer that patient to go to that clinic, and that clinic runs maybe once a week.
Yes.
And on this particular day, everyone from that hospital can attend the other one.
Yeah.
So those are ways of doing it.
Amazing.
That everyone still has the service, although it may not be at your doorstep, but the service is still there.
I like that you mentioned that the service is still there. It's really around figuring out the demand for maybe specializations, and that comes with education and ensuring that we have a higher stream of graduates who are graduating in those specializations.
Yeah, I think now we have a different conversation.
Yeah.
I mean, it's great to have graduates, right? But remember, a graduate needs to be placed somewhere, a medical doctor, for example, right? So I think it's a much bigger conversation than that. So where is the need? And if there is a need, is there availability? Are there posts available for these specialists to go to some of these institutions? So I think it's a difficult conversation to have. You can't just create posts at every single hospital. Doesn't quite work that way. But and sometimes, in actual fact, it makes sense to have your expertise in one hospital area, for example.
Yes. Excellent. This has been such an engaging conversation. Thank you for your time.
Thank you very much.
For your knowledge, and for also helping clarify what universal healthcare is, where we're at in terms of our progress as a nation, and also demystifying what it is. Because a lot of the time I don't think there's enough education being done, but it's in these conversations where we're enlightened. So thank you so much.
Thank you very much, Seth.
There's so much more we could discuss regarding this topic, but that's all the time we have for today. Thank you, Dr. Patrick, for joining me, and thank you to our viewers for watching. Don't forget to subscribe. Till next time. Proudly brought to you by BankMed.